Good evening, everybody. Welcome to One Team, One Mission, our Monday night call, where we encourage and lift up and educate along the lines of health, nutrition, finances. And tonight we're super excited to have, I'm super excited to have my husband, Dr. Bill Davies, who he is there. He has his camera off because he's going to be flicking through slides here and wants to talk to everybody. But I want to let you know that you're probably going to get the best view if you put it on speaker and so that you can see when he shares. I guess that's the best way. When he shares his screen side by side, you'll want to set it up that way. And he's going to maybe give a lot of information. And if you want to have that, he's not going to have questions, but it's going to be recorded. And just talk to the person who invited you tonight if you would like to have the link to watch the recording, and we can provide that. So with that, I know that he is, tonight is all about leaky gums, leaky guts, and leaky vessels. And that's pretty much health. So I'm going to turn it over to Bill, Dr. Bill, and he will tell his story and educate you a bit. All right, Bill, take it away. He's setting up his screen to share here.
You seeing it?
Mm-hmm. There we go.
All right. As Lori said, I'm going to be speaking from my heart. The title is interesting as far as most people don't understand the relationship between their mouth, their brain, their blood vessels, as far as your blood supply. That's important for your health. And then as far as your gut, we've probably heard a lot about leaky gut, but I think pretty much leaky brain and leaky gums are probably new to you, but they're all related to and I'm hopefully going to bring those words below there into better focus as I speak, as far as it says heart disease, cancer, chronic lung disease, stroke, Alzheimer's disease, diabetes, chronic kidney disease. All those are chronic diseases, and I'm going to be speaking on how Juice Plus relates to those. And as far as for those of you that don't know what Juice Plus is, it's a way of addressing a problem that, according to this, 75% of people say they don't eat enough fruits and vegetables. So Juice Plus is a way to bridge the gap between what people should eat and what they do eat. And it's based on the idea of, I guess, the Jetsons as far as food in a capsule, taking plant powders and dehydrating them and putting them into a capsule, and then you consume them each day. And sounds like a good idea, but we have to have a science back up that idea. So there's actually been research done on the Juice Plus products, and that's what I'm going to be speaking about tonight, as far as what does Juice Plus do in your body. So I am a dentist, and it's the research that attracted me to Juice Plus. It's the science that supports Juice Plus that keeps me consuming it every day. And I also like to tell others about it. And as far as, each of us is here tonight, and I think there's a reason why you're here. And hopefully by the end of me speaking, you'll know the reason why you're here tonight. My presentation is about making right choices. It's about doing the right thing based on science and objective numbers. It's on why you should Juice Plus, why you should choose Juice Plus if you haven't already, or if you are taking Juice Plus, why you should keep taking Juice Plus. As far as me personally, I have a strong belief in the Juice Plus products. I also have a very strong belief in the Juice Plus business opportunity. But I think the most impactful part of Juice Plus is the Juice Plus people, the Juice Plus culture. And the founder of Juice Plus, he founded the Juice Plus company his company in 1970. It turned into the Juice Plus company later on, but his mission was, when he founded his company, was to help as many people realize their dreams. And I know, meeting Jay Martin, the founder of our company, it was he introduced me to the idea of dreaming, and I think through my exposure to him, I'm dreaming bigger than I ever thought I would. I guess I'm going to keep us on the Juice Plus here research for a minute. As far as our story, Lori's story and mine, as far as in 2004, we just had our 9th child, and we were doing the best we could. But like most people, we didn't know what we didn't know. So I was fortunate enough to have a patient. He invited me to a presentation, and I surprised Lori with the knowledge that I'd accepted an invitation, and she was going to go with me. And we went to a couple's home to hear a presentation by a physician. At the presentation, we were introduced to the power of good nutrition on the human body and how it fed the body so it could heal itself and protect itself. We learned about Juice Plus and how we could nourish our bodies and those of our family and friends and patients in a research-supported, proven way. With, again, was plant powders, functional food. It was in capsules, it was in chewables, it was in the shakes. And we said yes to the Juice Plus products. And we also said yes to the Juice Plus business, mainly just to get the Juice Plus products at a good price, because again, we had 9 kids, and so we had a lot of mouths to feed, and we were concerned about using our dollars wisely. But I was concerned about my patients, and I saw benefit for me, but I also benefit for them. So we were going to share the idea with my patients. So we started eating the Juice Plus products, and we did start getting better health. And what we noticed, probably the quickest, as far as Lori noticed, she'd been suffering with ulcerative colitis for 24 years at that time, and she had bleeding from her gut pretty much on a daily basis. And within 4 to 6 weeks, she noticed the bleeding had stopped. And the thing I noticed was, I usually got the flu 2 or 3 times a year, and I noticed over a period of time that I wasn't getting the flu as often. And I'd say since 2004, I've probably gotten the flu less than 10 times. So it's made a big difference in my health too. And then of course we did notice our children being a lot healthier, as far as having a bunch of people in one house. Things used to come in the house, an illness, and it would go around and around for sometimes weeks. But pretty much when we started taking Juice Plus, we never really had that problem ever again. Not that we didn't get sick, but just didn't affect everybody like it used to. So, but again, the thing that really influenced us the most in a positive way was the people that we met through Juice Plus. And again, it really changed our lives. I've been a dentist since 1985, but I guess I'm introduced the idea to use, yes, I'm a provider of healthcare, but I'm also a patient in the healthcare system. So not only did I strive to provide the best care for my patients, but I wanted myself and my family to receive the best care. So my goal, personally and professionally, was creating the best health for everyone. But, at the same time, I was treating patients, and sometimes things would go well and sometimes they wouldn't. So I was always looking for answers as far as if you're a healthcare provider, you have to treat your patients well, use the standard of care to treat your patients. But at the same time, you're learning about new things and what might be coming down the pike, either in dentistry or really in healthcare as a whole. So you can, be aware so you can treat your patients to the best of your ability. And again, health is a complex issue, but if you follow simple principles, the result should be health. An idea I also want to introduce to you is the idea of we all have pillars of health that we're trying to support. As far as there's not one thing that produces health. There's a whole bunch of things, and I'm just going to refer to them as pillars. And I think the Juice Plus research that's done on the products shows how Juice Plus can support those pillars. And I'm going to go through that here in a minute. And I'm also going to be showing you how the business and just the culture, because it's really not just what we eat, it's a whole bunch of things that produce health. And one of my mentors, he tells a story of a 98-year-old patient of his comes in and he asked them how they were doing. And they said they were doing well because they had the best doctors in the world. And here in a minute, I'll reveal to you who their best doctors were, so you can be in contact with them. And my name isn't on the list of the best doctors. As far as in our world today, I think we're all pretty much familiar with the idea of a lifespan, how long we live. But how about your health span? What is your health span? Well, I'm just going to tell you what your health span is how long you're healthy. Your lifespan is how long you live. And what we're finding is people are living a lot longer than they are healthy. So, and one of my mentors there he's got that book, Peter Attia. He's talking about medicine 3.0, what we can do to move our health span closer to our lifespan. As far as my goal is to live a full life, be involved. Again, I'm a dentist. I'm involved in healthcare every day, but personally, I'd like to have as few visits, as few involvements in our health care system as possible, because that's really, I want to be healthy as much as I can. So our goal, what our focus tonight is going to be on a term. I'm going to say it's right there at the top. Lori said there's a lot of stuff on this slide and maybe you can't see it all, but our goal is to understand what metabolic health is, because what we're suffering with is we're not involved with having metabolic health. And I told you I was going to tell you who the doctors were of the 98-year-old patient. Her doctors were Dr. Rest, Dr. Nourish, Dr. Move, Dr. Connect, Dr. Grow, Dr. Reflect, Dr. Remove, and Dr. Compose. And I know there was a lot of writing there, but just, I think we could talk about this. It could be another talk some night, but I think the Juice Plus products, the Juice Plus people, the Juice Plus culture really supports all these ideas. It's a real positive environment. And I said, as far as in the upper right-hand corner, you see a picture of Christine Burke. She's a physician, and my focus, my goal is to give you hope about healthcare. As far as I've already talked about the problems that we have, but Dr. Burke, like Dr. Attia, is making a really significant impact in healthcare as far as she treats patients every day. She also does research, and she's helping people reverse their cardiovascular disease. She helps people reverse dementia and Alzheimer's. So they're there are people that are making a difference out there. Their ideas are real. Their ideas, just like Juice Plus, are supported by research. And what I'm finding is people aren't aware that such a thing exists. So I'm trying to get the word out on what's out there, what people are making a difference, and how you can get access to that care. As far as I'm a healthcare provider and people are interested in health, and I'm just going to let you know, Juice Plus doesn't make any claims on disease prevention, disease treatment, or disease cure, but it is a support for health. And I'm going to tell you right now, through the research on Juice Plus, why you should be taking Juice Plus every day. It's one of those things where habits are important, and Juice Plus is a daily habit that supports health. As far as Juice Plus research has been published, and it's been going on since, I guess, shortly after it was introduced in 1993. I think the first research was published in 1996, but through all the years, these are the things that Juice Plus is, the research has showed what Juice Plus does. It's bioavailable as far as the nutrition in the food powders gets into your body, and your body knows what to do with it. As a result of it getting into the body, it supports your immune system. It functions normally. It provides antioxidant protection. It decreases the biomarkers of inflammation. It protects your DNA from oxidation. It improves your key cognitive processes. What I say that does is it just shows that Juice Plus gets into your brain and helps your brain function well. Your brain helps us do all the things we need to do. So Juice Plus is proven to support that. It helps you have healthy skin. It helps your mouth be healthy, supports your cardiovascular system, helps your lungs get the oxygen into your body, supports metabolic health. It reduces exercise-induced oxidation, and it supports gut health, and it increases your omega index. So again, our goal, as far as what we should be striving for, is metabolic health that will allow us to do all the things we need to do through our busy days. But the facts are, in this time, with all the positive things that we've had occur in our world, all the technology that is around, the fact is somewhere around 90% of our population is metabolically unhealthy. Only 1 in 10 Americans is metabolically healthy. So we're surrounded by 20% of our gross national product, almost 20% of our gross national product is healthcare. One of our biggest industries is us taking care of sick people, which, that's just not a good thing. And what's even worse is we're only getting sicker. So we need to make a change. Metabolic dysfunction is the root of all the chronic diseases that we face today. And if you look at the trunk of the tree there, metabolic dysfunction, as far as oxidative stress, chronic inflammation, and mitochondrial dysfunction, those are what is called the trifecta of metabolic dysfunction. And Juice Plus has been proven through the research to have a positive impact on all of these things. So it's not a cure of anything, but it has a positive impact on oxidative stress. It has a positive impact on chronic inflammation. It has a positive impact on mitochondrial dysfunction. Just as an idea, as far as chronic inflammation is known to be a cause of all these diseases. So just chronic inflammation is powerful. Again, Juice Plus has all these things that it's proven to do. We're going to focus on the metabolic health, as far as we're aware of when we go to the doctor, we get our blood pressure taken. If you're getting a physical, they're going to find out what your blood glucose is, your blood sugar level is. They're going to weigh you. The abdominal fat part of it, that's a little more sophisticated analysis has to be done to really determine that. But just looking at your height and weight, there's kind of an estimate of, BMI, and there's your cholesterol and your triglycerides. But Juice Plus is proven to have a positive impact on insulin resistance in young boys, and it also helped reduce their abdominal fat. And then it also in adults, it was able to increase the lean body mass. So it had a positive impact on total cholesterol, LDL cholesterol, and blood pressure. So as far as we talked about inflammation being part of that trifecta of metabolic dysfunction, your inflammation is important. It's part of what your immune system does to protect you from injury and insult. It's just when it becomes chronic, as far as acute inflammation is usually good and chronic inflammation is usually bad. Juice Plus has a positive impact as far as it decreases the levels of several biomarkers of inflammation, as far as when you go to the doctor, and that's something that it'd probably be another talk, but we need to be aware of what those biomarkers of inflammation are. So again, inflammation is going on. Acute is usually good. Chronic is usually bad. And we're trying to decrease the bad energy in our body, as far as, again, one of my mentors, Dr. Casey Means, talks about in her book, Good Energy. We're trying to get rid of the bad energy. We're trying to reduce oxidative stress. We're trying to reduce chronic inflammation. We're trying to reduce mitochondrial dysfunction. So we've all heard the term antioxidants, and we know they're good, but what are they really doing? Well, they're antioxidants protect us from the oxidative stress. When our body produces energy, it puts off smoke, and that's basically oxidative stress is the smoke. And we want to, just like, if you're by a fire, your idea is to get the heat going and not to have a lot of smoke. And if there is smoke, you're going to get away from it because it's not good for you. Well, that's the same in your body. Smoke isn't good. Antioxidants help us to have less smoke. And if we do have exposure to smoke, it decreases the damage. In fact, in the Juice Plus research, it actually, people that smoke, they have less oxidative stress in their body if they take Juice Plus. All the things going on, the oxidative stress, the mitochondrial dysfunction, the chronic inflammation, all those are having an effect on our immune system, as far as our immune system is trying to protect us from all those things. And again, the research on Juice Plus shows that it helps your immune system, doesn't create a super immune system. It just helps it function normally. God designed us to have a normal immune system, and Juice Plus helps us have that normal immune system. All the tissues in our body, all the cells in our body are fed by the nutrients, the supplies they get from our bloodstream. So if we don't have a bloodstream that's healthy, a blood supply that's healthy, we are not going to have health. So that's where back to the title of this presentation, the leaky gums, the leaky vessels, the leaky gut, all those are related to having a healthy blood supply. And again, a biomarker, it's kind of right there in the middle of the slide, as far as homocysteine, a biomarker of cardiovascular health. You want to know what your homocysteine level is. When you go to the doctor, if he doesn't tell you what his homocysteine level, what your homocysteine level is, you ask him why he hasn't given you that number, because it's an important number for you to know, and it's an important number for him to know. And I would challenge you, if your doctor isn't finding out what your homocysteine level is, you need a new doctor. As far as when our body is functioning, the cells are constantly being replaced as far as new cells are being produced, and that's where our DNA comes in. And nutrigenomics, that's a fancy word, but basically it's how our body responds to the environment. And it's not the fact that your DNA determines your life. It's really how your body responds to what you put into it. And if you put in good things, then you'll have a positive outcome. The more bad things you expose your body to, then the more likely you are to have a bad outcome. So it basically, Juice Plus is proven to turn off the bad genes and turn on the good genes, so you'll have a better outcome. And of course, all our food, when we eat, it goes into our gut, and gut health is a big topic today. And Juice Plus, the research that has been done on Juice Plus and gut health is not as many as some of the other topics, but they're going to be producing more. But basically, if you consume a lot of fruits and vegetables, it's proven that your gut will be healthier. So Juice Plus just helps you have better gut health just through the association of eating more fruits and vegetables, getting more nutrients from fruits and vegetables into your body. And the dental health, again, your gums around your teeth, that's a barrier, protects the bone and your teeth from the bacteria that's in your mouth. And so again, the better your nutrition is, the healthier your gums are, the healthier your body will be. And I forgot if you're not into blood, this next slide might not, but it's basically, if your eyes were bleeding, that would get your attention. Most people, again, I've been a dentist for 40 years, and people, when they're having bleeding gums, is pretty common, but just because it's common doesn't mean it's good. So if your gums are bleeding, you need to do something. And again, the more fruits and vegetables you eat, the less likely you are to have bleeding gums. And we all want to have healthy lifestyles, active lifestyles. And one of the things associated with being active is exercise. And exercise creates a lot of inflammation. It also creates a lot of oxidative stress. But the research shows that if you get more fruits and vegetables into your body, you get more of the good, the benefits of exercise, and less of the bad. You have less oxidative stress, and so you'll be healthier. So again, our trifecta of dysfunction is what we're against. And I'm going to move down as far as all that to say, if you look at this, the doctor you're going to see, he should be trying to decrease the root causes of your disease. And all of that has to do with reducing inflammation, reducing oxidative stress, and then some of the things down there in the roots, as far as specific things, you need to have, know what your vitamin D level is. The better your vitamin D level is, the less likely you are to have health problems. And again, there's all these health conditions, bad things are associated with bad metabolic health. So you want to decrease those. So I want to point you to just people that are doing great things in our healthcare system. As far as these doctors, Dr. Bale and Dr. Doneen, they've been practicing their method for over 20 years. And their patients of theirs do not have heart attacks and strokes. Their patients don't have diabetes, just all the chronic diseases that most people have, they don't have. Another doctor that's doing great things is Dr. Dale Bredesen. If you follow his protocol, you're not only will you not have Alzheimer's or dementia, if you do have the symptoms of Alzheimer's or dementia, you can follow his protocol and you could actually reverse those conditions. So there is hope for cardiovascular disease and dementia, and most specifically the salivary diagnostics and a carota intima thickness test. Those are something that you can have done. They'll help you eliminate leaky gums, leaky vessels, and even the leaky gut. So again, our goal is to have metabolic health, and just some things you should know as far as you strive to have a BMI of under 25. Women should have a waist under 35, men a waist under 40. You need to know what your fasting glucose is. It needs to be under 100. Basically, you want to get your A1C hopefully down to 5, but under 5.7 is, so those are just some easily obtained numbers. If you're still having problems, you go to the next level of testing where you want to know what your CRP is, you want to know what your fasting insulin is, you want to know what your uric acid level is, you want to know what your vitamin D level is. So again, all topics for another talk, but again, these are things that the numbers that you need to know. So I'm making myself available. I'm trying to make a change in our healthcare system. I need more people. So if you want to learn more about how you can help make a change, this is my contact information. And again, I appreciate y'all's attention tonight. Thank you.
Thanks, Bill. We went just a couple minutes over, but I hope everybody really got a lot out of that. And he's going to, we'll be able to see each other here in a second. I keep getting rid of. I think you're still sharing your screen. But anyway, thank you for tonight. I will have the link for the recording for this and I will give it out. So like I said, if you were invited here by somebody, they will be able to get you the link. And if you're watching this afterwards, the same thing is reach out if you have a specific question for Bill, and be sure to speak, excuse me, to the person who invited you. With that, I will say good night. We'll be back next Monday.
Thank you, Dr. Bill.
Thanks, Bill.
Thank you,
Dr. Bill.
Thank you.